Good afternoon, everyone. My studies on analytical study of genetic polymorphisms on retinopathy of prematurity, progression and regression. Conflict of interest nil, financial disclosure nil. And as we all know, ROP is an ophthalmological disease of abnormal retinal neovascularization in preterm babies. And we all know all preterm babies with the same risk factors not equally affected. Why this is so? That is the essence of this study. We all know the prevalence of blindness in children is 6.5 per 10,000 children, and ROP is the second leading cause of blindness. And in ROP, 86% spontaneous regression occurs. And what happens to the remaining subset? So that is the essence. So in genetic polymorphisms that occurs in ROP, which is the root cause for the ROP, is the background. And here, what happens in the genetic sequencing? There occurs inter-individual variation that leads into the alteration of the proteins in the genes and as well as the level of the protein products. That leads to the formation of ROP in progression or regression. So objective of the study is to analyze the genetic polymorphisms of VEGF 936TC, then angiotensin converting enzyme insertion deletion, tumor necrosis factor 308G and A, and glutathione S transferase protein 1 genes on ROP progression and regression. And methodology is, it is an analytical study, and we have analyzed 100 babies which come to our department, and the period was done as May 22 to December 2023, that is 1 year, and the inclusion criteria mild, moderate and severe ROP, that is according to the stages of ROP according to IC-ROP classification. And exclusion, we have excluded babies having ocular systemic anomalies and the babies on any drugs and mothers not willing to participate in the study. And methodology, we have divided the babies into two groups. One is ROP with progression and two is ROP with regression. And blood samples were collected and we have analyzed for the frequency of genetic polymorphisms. So the techniques used is for VEGF, we have used PCR with the restriction fragment length polymorphism, and these polymorphisms are digested with the restriction enzymes, and ACID is alone analyzed with PCR and ARMS PCR. And the demographic profile here shows the age group is averagely 39.24 weeks and birth weight averagely 1.5, it is less than 1.5, and sex male it is about 51 and female babies 49, and babies in progression is 34% and regression 66%. And when we analyze the stages of ROP, the stage 1 ROP babies accounted for 37%, followed by stage 2, then followed by stage 3, and aggressive posterior pole ROP accounted for 4%. And these are the allele and genotypic frequencies analyzed, and here the p-value had a borderline statistical significance only for anti-VEGF gene. Okay? And correlation between stages and genetic polymorphism showed after reducing the confounding factors, the p-value came to be significant for this VEGF gene and also ACE insertion deletion gene. So you can see here for the ACE insertion deletion polymorphism, the p-value came to around 0.05. And for VEGF gene, the p-value was 0.03. So the analysis results ultimately was the ACE insertion deletion polymorphisms was significantly noted in regressing ROP babies, and VEGF gene was significantly noted in progressing babies, and no statistical differences were found in the TNF alpha polymorphisms and glutathione S transferase gene polymorphisms. So comparison with previous studies, and in Saudi Arabia and Turkish Kuwaiti peoples, they have done previous studies. And in these previous studies, the Kuwaiti and Turkish study showed a ACID polymorphism and ROP risk regression. And Chinese study, there was a significant association between TNF and VEGF polymorphisms. And it was the one of the South Indian study, first of all Indian study we have done. And here we reported an association between ACID polymorphism and regressing ROP and VEGF polymorphism with progressing ROP. And only limitation is our sample size. We have done a 100 baby study. It was done as a pilot study, and the ultimate conclusion of the study is actually we have to guide the development of the targeted and early treatment for infants at the risk of progressing ROP and thereby preventing blindness. Thank you, sir.
Thank you so much. Dr. Marisha?
Okay, so I just wanted to know that how do you get genetic testing done for so many people, though you call it limited,
Sir,
but...
actually, we are doing a ROP screening for nearly 1,300 babies per year, sir. And we have diagnosed nearly 130 babies, and we have get consent from our ethical committee, and we are collecting blood samples from them, sir, and consent from them. And we have medical research unit in our medical college. And
but the consents from the parents for genetic testing
yes, sir, we
is
get
not a problem.
consent from them, but not from the parents. We get consent from the parents. We take blood samples from the babies and we send to the lab, sir.
Right.
So based on your study, in future, we will be able to predict how the progression of ROP is
Yes,
going to
ma'am.
be by doing a blood testing.
Yes, ma'am.
That will be something
Yes,
interesting.
ma'am. Actually, we have more studies on management, but prevention, we have only limited studies. That too, we have meta-analytical studies only in the Indian population. In Indian population, we don't have a genetical study for prevention.
No, but prevention would be means parent sample or child sample?
Child sample, we have analyzed child
As
sample,
born-
sir,
as-
but we can proceed with the patient, mothers also we can do, sir.
Right.
Thank you
Thank
so
you.
much.
Thank you, ma'am. Thank you.